Now, India has surpassed Brazil to become the second worst hit nation by the COVID-19 pandemic. Speaking of which, we have a very important guest with us today, Dr. Ashok Seth. Dr. Seth is the chairman and cardiologist at Fortis Escorts Heart Institute. Thank you so much, sir, for taking our time and speaking to us.
Pleasure speaking to you. Thank you.
Sir, I'd like to begin by asking, the World Health Organization has said that India has been reporting the highest number of deaths and the daily COVID cases. What is your assessment of the current COVID situation in India?
Right, we've got to look at it in multiple ways.
Yes.
Firstly, we must understand that India is a very populous country, in fact, the second largest country in the world, and also happens to be the third or fourth most congested country in the world as well,
yes,
if you consider the population per square mile. Now, when we have such a situation, what we should look at not just absolute numbers, but the percentage of the country which is affected at the moment. So absolute number-wise, we are certainly high up there, but in terms of the whole population, we're certainly less than many other countries of the West. The second aspect is that, yes, this is a virus. It survives by spreading. It is contagious.
Yes.
And certainly in the West, there's a higher mortality as compared to India. Now, mortality is something, death is something which hurts us all, and we want the death rate to be lower.
Absolutely.
Spread of the virus is a natural phenomenon, and we have to do everything to limit the spread of the virus. But really, the consequence is that majority of the people, which is 80–85%, are going to have minor infections, almost just like a common cold. But it's that people who get very sick, which is less than 5%, and the ones who die, which hurts us. And thankfully, at the moment, the death rate in India has been substantially lower than many of the Western countries. You know, England, for example, had the death rate of around 10–14%, and that happened in Spain as well. But we see death rates of under 2%. Now let's hope, and you know, death cannot be hidden. Death is obvious phenomenon, it's documented.
Yeah.
So we are actually therefore saying that let's keep our death rates down.
Yes.
Let's make sure that we don't get overwhelmed, because India is a vast country, the virus is spreading, and we've actually got to take care of our people. So there's no question around that. But the second aspect also is that we must remember that we've really upped our testing phenomenally.
Yes.
So there are a number of reasons why we're seeing this. One is actual increase. As we unlock the country, it is bound to happen that as economy has to be opened up, so unlocking is a normal phenomenon. We've got to live with the virus. And we're going to see a spread of cases going to the hinterland, going downstream into the tier 2 cities. There's been a movement of population which has happened. Places which previously did not show the cases are now showing cases, and everywhere it's increasing. But we also have to understand the important fact that at the same time, we've ramped up our testings. We've seen that happen in Delhi itself. We're at 50,000, more than 50,000 plus cases, testings in a day. We're going to turn up more cases.